Good afternoon. My name is Lee Champion. I'm the Clinical Director, Risk and Compliance for Health Partnership Clinic. We're going to be talking about patient safety. Patient Safety Awareness Month is coming up in March, so we felt this was a good opportunity to kind of bring some pointers out regarding our patient safety. Patient safety at Health Partnership is absolutely paramount to the safety of our patients and our staff. March is the upcoming month for patient safety awareness, and I'm looking forward to an opportunity to kind of explain a little bit about what we have going on here at Health Partnership regarding patient safety. So we look at a lot of different things at patient safety. We look at medication administration, making sure that we have the right drug for the right patient. We have dual identifiers for our patients that mainly here an outpatient is looking at the patient's name and date of birth. Before a medication is administered, it requires the physician to take a look at the order, who put the order in, and take a look at the order. And then a medical assistant or nurse will take the medication, draw it up, and then verify it with a second person to ensure that it is the proper medication before it is administered to a patient. So that's one way that we look at it. A second way is during the visit, we like to clarify with patients, again, using that dual identifier, name and date of birth, and making sure that we have the right patient in the room. Our front desk people also do a patient safety check as well by identifying people by their identification cards, date of birth, verifying all their financials, because what we don't want to have happen is a wrong patient who we have accidentally mixed up. Mixing up with another patient. We've had some situations where we have had two people with the same names and close to date of birth, so that's why we do a lot of checks at the front desk before the patient ever comes back. Another way, again, is when we do procedures on patients, it's the same thing. We're looking, even though you may have been in the room with a provider, and if you go to another room for a procedure, we also want to do, again, another check to make sure that we do have the right patient, name, date of birth, and that the procedure is correct. If there's any injections or whatever the procedure is, that we're doing the right procedure on the right side on the right patient. Many other avenues that we have, our vaccine program is all in a machine that's called an AccuVax. So it is controlled by fingerprint sign in and sign out. It will not allow us to withdraw medications that are not for a specific patient. So our infection control is another way that we also keep our patients and our staff safe. For instruments that are used on patients for procedures, we have a sterilization process, and it's about a 5-step process how the instruments are cleaned and then they are sterilized. We identify them. We're always looking to ensure that the equipment is appropriate and there's no damage done to it, because we don't want to injure anyone by an instrument that is broken or chipped. So we have that process as well. Hand washing is another way that we keep our staff and patients safe. With the events of COVID that happened and influenza, so we've had a dual season, keeping patients and staff masked at all times when they're in the clinic and in exam rooms, and then washing their hands, but it's also hand gelling in, hand gelling out, and again, just making sure that everyone is washing their hands. We post signs in every bathroom and exam room that we have for patients and staff to be sure and wash their hands and use hand sanitizer. So patients, one of the biggest things that you can do is when you first come to the clinic is make sure that you have some photo ID available and that we have your information about you. Always ask questions. If something doesn't seem right, please ask questions. If you do not understand a medication change or an MA is going to give you an injection, ask questions. Sometimes things happen and maybe you were supposed to get medication and it wasn't the right time. But again, the biggest thing you can do is ask questions during your visit. Another way that patients can help keep themselves safe also by not running out of medication is to alert your provider ahead of time. Don't wait until you're on the last day of your medication to call in. So be mindful to see how many days you have left, and then we utilize the portal. That's the best way to communicate with your patient, because then that documents it in your medical record, so that way there's no mistaking that it accidentally went to a different patient. So that's one way of helping yourself as well. Another way that we keep our clinic safe and our patients safe is children, when they come to clinic, we're still utilizing some of our COVID standards by not having a lot of people in the exam room. But if you have to bring your children in, we do ask that you keep your child with an adult while you're in an exam room, because children running up and down hallways and jumping on the furniture, sometimes those chairs tip over, or they're in the hallway and they could accidentally run in to an elderly person and knock down, or they themselves can fall and get hurt during our visit. Currently, we still are utilizing telehealth visits for patients that maybe are too sick to come actually to the clinic, or they're not feeling safe still in coming into a clinical setting for the visit. So those, they just need to call the front desk and request a televisit, and then they will give you the instructions on how to access that televisit with your provider. When patients come for their visits, it's really important that they bring a current list of medications that they are on. That's for your safety as well as for our providers in prescribing. And especially if you see a different physician, if you have a different doctor that you see, maybe an endocrinologist, nephrologist, it's important for us to know what medications you're on, because we don't want to cross anything that could become harmful for you. So having that list, plus it helps the provider to make sure that you're not continue to take medication that maybe they have discontinued in the past. So it's a good double checklist. Like I said, we like to double check everything before we do anything with our patients. So for our COVID measures, yes, we're still doing COVID. We do ask that all patients mask up when they're in our clinic. Again, utilize our hand sanitizers. We still offer testing, COVID testing, and we do have an assortment of the vaccines available. So if a patient wants the first vaccine, absolutely we have it, or if you need a second or third booster. So we do have a COVID vaccine clinic. It's the second Friday of every month. It runs from 5 to 6 p.m. And we encourage you to come and continue to get those vaccines. You know, we have seen a decrease in the number of illnesses with COVID. That number has definitely dropped, and I think it is because of people getting their COVID vaccines and the additional boosters that are with them. So again, all you have to do is call the front desk, and they will be more than glad to schedule you for your additional shots that you might need for COVID. Testing kits are available for all patients. They are free of charge. We do have masks also that we put out in the front. So if you are in search of a COVID kit, stop by the front desk. We have them available for you at no charge. At HPC, we really enjoy partnering with our community. So we do offer COVID vaccines outside of our four walls. So if you have an organization or a company that is needing additional vaccines, please call us and let us know, and we'll be more than glad to come to you. So if you need COVID shots, we do have availability here at HPC Olathe. You can reach us at 913-648-2266, and we take new patients as well as folks that just need an additional booster.